Stereotactic radiosurgery is a treatment that we use to treat brain tumors or other cancers that have spread to the brain. It's a treatment where we deliver a really high dose of radiation to the tumor and just the area around the tumor without treating the whole brain itself, and that can be in anywhere from 1 to 5 treatments. Every treatment with radiation, unfortunately, does have a risk of side effects. So when I first meet the patient in consultation, I spend at least an hour with them, and we talk about everything. We talk about their stage, where the cancer is, what our treatment plan is, how the treatment will be delivered, but then also what the possible side effects are. What we worry about with SRS is that when you have a tumor that's in the brain, that can cause a whole number of symptoms. And unfortunately, the treatment itself in the short term can make some of those symptoms worse. So we always talk about headaches, nausea, vomiting, numbness, tingling, weakness. Those are things that patients should look out for. Now, a lot of those symptoms are extremely rare, but we give them a whole list of things that they should be looking out for, and there's always a doctor on call, so if they start to notice anything, they should call us right away. The first step in planning and treatment for SRS is actually doing a CAT scan. We bring the patient into our department, they will lie flat on their back. We make a mask that will cover over their face. It's a mask that is very soft and pliable while it is warm and wet, but as it cools, it hardens, and it gives us a tremendous amount of accuracy in keeping the patient in the right position and not allowing them to move too much on the table. So that mask is there to immobilize them so that they can't move while they're on the table too much. That way we can deliver a really high dose of radiation. So we make that mask when we do a CAT scan. We use that CAT scan and we can see exactly where their tumor is. Oftentimes we'll get an MRI as well, and we can fuse that MRI so we can put those two pictures together and see exactly where that tumor is. We can then look and see where all the normal structures are that we care about. There's a lot of very critical organs that are close by. And then we create a radiation plan where we say we want to deliver a really high dose to kill that tumor, but at the same time not overdose or treat too much radiation to any of those normal structures. So that's a planning process that sometimes takes us about a week or so. Then the patients come back, we use that same mask that we made in the planning, and we can get them in the same exact position. They're on the table for anywhere from like 20 to 40 minutes, and the radiation machine will move to where it needs to go and delivers really high doses of radiation just to that tumor. And that would all take place in our radiation department here at the new Green Cancer Center.